Hi, my name is Meredith Mistledine. I'm a nurse practitioner student at Auburn University, and this is my suture demonstration video. Before we begin preparing the wound, we first want to obtain a little history from the patient. We want to assess their past medical history, if they have any conditions like diabetes that could lead to delayed wound healing. Also their allergies, especially to anything that we might use while suturing their wound, and then also how and when the incident happened that led to the wound that we're going to be suturing. So first we would want to don our gloves, and we would want to start by cleaning the wound. So in order to clean the wound, you want to start by flushing it just with normal saline or sterile water just to decrease any risk of infection. And then you'd want to clean the wound with betadine, or if there's an allergy to betadine, you can clean with the diluted Hibiclens. So after the wound's in clean, you'll want to take about 3 to 4 cc's of local anesthesia or more, depending on how large the wound is. You can use 1% lidocaine, or you can use lidocaine with epi if they have excessive bleeding. But you want to make sure that you don't use lidocaine with epi on places like the fingers, the toes, the penis, ears, or the nose, just to prevent any necrosis. You'll want to take your lidocaine and you'll want to have a subcutaneous needle. You'll want to inject the needle bevel up into the area surrounding the laceration. And then as you're withdrawing the needle, you'll want to start injecting that anesthesia, making sure that you get all areas of the wound. This can be done as many times as needed just to make sure that the wound is numb before you begin suturing. And then you can take that same needle and you can test the wound or test the area just to make sure that it's numb, and just ask your patient, can you feel this? If they can, you can repeat the process and add more anesthesia. So then you'd want to select your suture size. The bigger the number, the smaller the needle of the suture. So if you're suturing the scalp, you normally want to use like a 4-0 or a 5-0. And then you want to remove those within 8 to 10 days, or 5 to 8 days, excuse me. And then if you're on the face, you want to use a smaller needle, such as a 5-0 or a 6-0. And then you want to remove those within 3 to 5 days. For the chest and the abdomen, you want to use a 3-0 or a 4-0 and remove those within 7 to 10 days. For the back, you want to use a 3-0 or a 4-0, remove within 14 days typically. For the arms, you can use a 4-0 or a 5-0, and then remove within 10 days. And then on the legs and the feet, you can use a 3-0 to a 4-0. And then you want to remove within 12 days for the legs, and I think 12 days, 10 to 12 days for the feet. So there are non-absorbable and absorbable sutures. For absorbable, you would use for things like inside the body, like a laceration after a vaginal delivery. For this video, I will be using a non-absorbable suture. And then I will be using an interrupted technique. So I'm just going to adjust. Let's see. Make sure you can see it. All right. So you want to start, and you want to I use hemostats. Some people don't. You want to use your forceps with teeth. You want to have your scissors, and you want to also have your needle holder. And then also your suture. All right. So to load the needle into your holder, I grab my needle with my hemostat. Some people use their hands, some people use their forceps. I find it easier just to use the hemostats, but you want to load it kind of at the edge or the end of the needle into your needle holder, and you want to lock it into place with your needle holder, so like so. All right. And then when you go to insert the needle, you want to insert at a 90-degree angle, and you want to use a wrist twisting motion just to be able to appreciate the edges of the wound together. And then you also want to insert about a few centimeters away from the wound. So kind of a few centimeters above the wound. And then as you do your wrist twisting motion, you will come out with your needle a few centimeters on the bottom of the wound. And then you also want to use your forceps just to kind of make sure that you're fully penetrating the dermis. All right, so we're going to insert it at a 90-degree angle, and then we go in, come out a few centimeters under the wound. We will grab the end of the needle with our forceps or our needle holder. And then you want to have that, you want to leave that tail about 1.5 inches. All right, and then we're going to make our surgeon's knot. So I do the 3-2-1 method. So I go 1, 2, 3. 1, 2, 3. And then I grab the end of our tail, and then I pull tight. All right, and then for our second one, we're going to do 2, but we're going to do it in the opposite direction. So we went forward, so now we're going to go back. So we're going to go back 1, 1, 2. We grab our tail and we pull tight. And now we're going to go forward 1 time, grab our tail, pull tight. All right. So now we've got that done. So now we're going to cut the tail off. You don't want to leave it too short because you still want to be able to grab the suture if needed. And then you want both tails of the suture to be about the same length. So again, we're going to load our needle into our needle driver. I use my hemostat. Lock that into place. And then we insert a few centimeters above the wound, 90-degree angle. Use your wrist twisting motion. Come out a few centimeters below the wound. All right, and then leave about that 1.5 inch tail. And then our surgeon's knot. So 1, 2, 3. Grab our tail. We pull tight. And then now we're going to do it in the opposite direction. We go twice. And we pull tight. And then we do it again. Back forward again. Go in our opposite direction each time, pulling tight. And you can add more knots if needed. Just depending on the size of the wound, or if you just feel like it's not secure enough, you can add more as you feel is needed. So then we lock our needle into place. And then we're going to insert at a 90-degree angle, a few centimeters above the wound, come out a few centimeters below, leaving that 1.5 inch tail. And our surgeon's knot again. So 1, 2, 3. Grab that tail and pull tight. And then we come, let's put down here. We come the opposite. We did forward that time, so now we're coming back. And we're pulling tight. And then we're going forward this time, pulling tight. And then we have our tail that we're going to cut off. Making sure it's even and making sure that it's not too short. That's 3 sutures. We're going to do 2 more. Let's grab our needle, load it into our needle holder. Insert it at a 90-degree angle. A few centimeters above the wound, come out a few centimeters below. And then that tail a little too short, we'll just pull it back. So then we wrap once, wrap twice, wrap 3 times, grab our tail, and we pull tight. And then we go backwards this time twice, grab our tail and pull tight. And then we go forward, grabbing our tail and pulling tight. So now we're going to cut our tail off. There they are. One, and then we've got one last suture to do. And you want to make sure that your sutures are about 10 millimeters apart. You don't want them too close, but you also don't want them too far apart. Because you don't want them to have any gaping in your wound. You want to make sure that the edges of the wound are completely approximated. So in at a 90-degree angle. Use your wrist twisting motion, kind of following the needle. Oops, and then our surgeon's knot. So 1, 2, 3, forward. Pull tight. And then we're going to go backwards. And then mine looks tail sometimes does not act right. So we're gonna go backwards. 1, 2, 3. And then forward once. All right, so now we're gonna cut that off. And then we are done with our sutures. Try to make them as evenly as possible, evenly spaced out. And then again, you want to make sure you don't leave any gaps. So after the suture is over, you want to educate your patient to keep that area clean and dry and covered for the first 24 hours. After the 24 hours is up, the patient can uncover the wound. However, they need to keep it as dry as possible. So avoid submerging it in any kind of water like bathtubs or going swimming. The patient can also apply an antibiotic cream to the wound twice a day, such as Neosporin. You would want to see the patient back kind of depending on the location of the wound. We talked about that earlier with the different sites, such as the face, the back, the abdomen, the head, anything like that. The longer that the suture's in, the more risk of scarring and infection that the patient has. And then you also want to educate the patient on signs of infection to watch for and when to come back and be seen if they see any of these signs. So you want to tell them to watch for things like redness, swelling, discharge, purulent drainage, a fever, swollen extremities, or swollen area wherever the wound's at. If they see any signs of infection, they need to come in, be seen. So we can culture the wound and then also prescribe any oral antibiotics that might be needed. So again, my sutures, and this completes my video. Thanks for watching.